Wonder Woman, to be honest. She is involved in everything, and anything that she touches turns to gold. I'm just so impressed with her and her dedication to the industry. In 2019, Christine won the Women in Wellness Award from the Global Wellness Summit, which is a very esteemed award. And then in 2020 in Boston, she won the Mental Health Practitioner Award, so from the Global Wellness Summit as well. Christine has programs throughout the world. She's working in Dubai, she's working in Ireland. She has a school dedicated to learning and touch. And I just am always impressed with her vast knowledge. So today she's talking about immunocompromised care in spas and communities, and I'd like to welcome Christine Quinn.
Thank you, that's quite the introduction. Sometimes I forget who you are talking about. But I'm very pleased to be here again to see so many familiar faces and meet some new ones too, which was great. And to Mike's point, there is very little to no ego, and it's really nice to be able to just stop and talk to someone and find out who they are, what they're doing, how long they've been in the industry, and so on. So I really enjoyed last night, the casualness of it, how easy it was, just grab some wine and chat and hear what people are doing. So it's really lovely to be here. Thank you for inviting me, Mike. I wanted to talk about immunocompromised clients because we have this notion, or at least we had the notion, that it wasn't safe to do a massage for people who are immunocompromised. And we know that's actually not the case at all. And even we talked earlier on about water and hot springs. I think we talked about that on our walk this morning. But you know, there's so many studies that support the use of using hot springs, because of the community atmosphere associated with that, but also because of the healing benefits of water. But all too often, our clients that are immunocompromised are asked not to be around people. Stay away, stay indoors. Don't have plants or flowers around you because you can get sick. And when we just look at what we're talking about, the built environment and what we surround ourselves with affects our mood. So you're never going to get well if you can't do those things. Be around people and have touch. And you know, intentional touch is magical. It changes everything when we feel that we can be comfortable in our own skin again. So that's the basis of what we're going to talk about. You know, when we talk about the conditions that are associated with that, sometimes being immunocompromised can be inherited, can arise from a result of medical treatment such as chemotherapy. Sadly, every 30 seconds someone in the United States is diagnosed with cancer. So when we just look at those numbers, the American Cancer Society says we have 18 million cancer survivors in the country. So it's a lot of people that come into our spas. But it can be caused by other diseases such as HIV and AIDS and other certain types of cancer. But abnormalities of the immune system can lead to allergic diseases, immunodeficiencies, and autoimmune disorders. So the numbers are startling because according to the CDC, nearly 6.2% of adults aged 18 to 64 lived with a weakened immune system. So what does that look like for us in the spa? Sometimes they don't tell us. Our clients don't tell us that they're immunocompromised. And you know, some of that started because of the fear of being turned away from the spa. And we know it was happening a lot, not just in the US, but across the globe. And two big cases happened in the UK where the guests actually sued the spa for discrimination because they weren't being allowed to have a treatment, even though their oncologist said they could have a treatment. So this became big news in the UK and around in Ireland and elsewhere in Europe. It started to be a mantra that says people who need touch need to be able to come in and have a safe treatment in the spa. And what does it look like to have a safe treatment? It usually just is adaptations in the same way that we adapt for somebody who just had recent surgery, adapt for somebody who's pregnant, adapt for somebody who has a risk of deep vein thrombosis. Everything is just adapted for the client. And I think that's what we really need to know about what we can do for our clients. But the most common conditions that we see in the spas are people with a history of cancer, type 2 diabetes, heart disease, kidney disease, HIV/AIDS, and then transplant recipients. Now, obviously, there's times that it isn't safe to come into the spa. If they've just had a transplant, then usually they know not to come in. But the problem that we have in many cases is that the doctors, our medical community, are giving what I would consider is poor information. And they're not really explaining very well to a client, or in their case, a patient, as to why they can't have services. And very often the information, as I said, is incorrect. As people who work in the industry, you'll get a kick out of some of this, but these are some data from Sloan Kettering, when it talks about skincare guidelines after radiation. Neutrogena, Dove, and any other over-the-counter medications. It's on, this is current, I printed this off right before I left. So, and I have talked to them, and there are departments for a new department of oncodermatology, because we know that certain types of treatment, particularly chemos, cause radiation dermatitis and chemotherapy rashes, something called an EGFR rash, epidermal growth factor receptor rash. So the thing is, the oncologist is thrilled to see the rash because it shows that it's working, but the client who has to live with it has 9 months of a rash, right, which obviously affects their mental health and their ability to participate in normal things that would ordinarily bring them joy. So going outside and being around people. So we have to think about how we get around that. And I really think the answer then is really education. I think we must take the time and effort to invest in advanced education in our SPA teams. I know for some we talk about the disparity between education from the beginning, the core competencies we learn at Massage School here versus in other countries. But I just believe that with the right education, every therapist should be able to adapt any treatment for any client based on their presentation. So I think, as I said, we have to collaborate with the medical community to help them understand our world a little bit better. I think they just don't really know what we do. They think massage is fluff and buff. They don't really recognize it as a therapeutic pathway to healing and well-being. You know, case in point, lymphedema. It's a massive problem for people who've had cancer because they radiate lymph nodes and they remove lymph nodes. And once they're gone, they're gone. So the problem we have with that is there's this misnomer, well, if you're 5 years out, you're fine, you can do whatever you want. This client is 5 years out. And I just taught a class in Scottsdale last week, and we had someone there who was 35 years since she'd had breast cancer and had a double mastectomy, and nobody had ever touched her scars. We did a scar tissue release treatment, and the woman was really, really emotionally, aware, let's just say. It was the first time anybody had ever touched her scars in 35 years. It seems impossible to me that that can happen in this day and age. So if you know what to do, then obviously there's always something we can do for a client. But I was going to talk about lymphedema there because, you know, a lot of women are told, don't lift this weight and don't use your arms this way, and all of the things they're told not to do. And we never tell people what to do. It's always the not. And when you meet fear with more fear, you just get more fear. And if we don't break the cycle through the gift of education and through a gift of touch, it's never going to change. So if a client has type 2 diabetes, they have neuropathy. So do clients who just had platinum-based chemotherapies will have neuropathy. So we could do both types of techniques and treatments on clients that, as I said, it could be type 2 diabetes, it could be cancer. There's lots of things that we know cross over, and many people who have a diagnosis of cancer will also have some of the comorbidity. So it's up to us as practitioners and educators to be able to recognize that and to be able to help our therapists to do a better job. I mean, most often they really want to know more. They just don't know where to begin and how to find out more information. But I was at an event recently too, and it was the first time that I'd ever seen this, but it's lymphedema prevention. So right now in the US, we don't treat anybody unless we can see swelling. So they don't recognize stage 0 or stage 1 in lymphedema. And that's obviously when you can do the most benefit for the client. So we talk about immune boosting treatments here now, and people want to have IV treatments and show me other ways to boost my immune system. And some of the things we did this morning, like going for a walk, is a way to boost your immune system. Having massage is a way to boost your immune system. But again, oftentimes these patients or clients are told not to do those things. And that's why I think we really, really have to think about how do we get a bunch of oncologists into one space and say, okay, here's where the science shows us that we can be helpful here. and not only helpful in the short term, but that it really can change the mental health of the client if they don't feel so isolated or feel so rejected. But we have an opportunity to support the physical and mental health of our compromised guests when we understand their challenges. So one other thing I noticed too in some spas, they don't do an intake for the clients, where we do an online one and our clients lie because they don't want to be told, no, you can't get this treatment. They heard about this new sugar scrub, they're time to try it, their friends have tried it. So they sign up to come into the spa, they don't tell us, and then the therapist is looking at somebody who has a colostomy bag, or somebody who has had a double mastectomy, or somebody who's new scars on their body. And that's not fair to the therapist either. So we have to think about how we can minimize the risk to the client and minimize upsetting our therapists as well, because they deserve to have the education if they want to have the education. So, when we look at, as I said, the information, sometimes they're told not to use the sauna, hot springs, or thermal baths. And there are times that it's important not to, because obviously there are times that the risk for infection is high. But we also have to look at the socialization aspect of it, and particularly after COVID. There's so many people that were really struggled with their mental health after 2 years of isolation. We're social animals, we're not meant to be locked up and away. And the fear of being in front of someone, never mind the fear of being touched. So, we really have to get past that. So we have more work to do than we ever had before. The Global Hot Spring Initiative, I'm sure you know, produced an evidence-based, very lengthy study to show the benefits. That's available online, I'm sure you know that, but the benefits of sauna and spa and thermal bathing, and I know there's a resurgence in that area, so I'm really pleased that we have that. I met Sharon this morning, and we talked about that, because it's really important to think about how we can help from a community perspective as well. So there are still therapists. I'm actually doing a training in Syracuse in December, and the spa director said, I've got about 38 therapists here, and half of them are really interested to do the training, and the other half are terrified because they've been trained not to touch anyone with cancer. Please tell me they don't think that cancer can be spread by massage at this point. And he said, I'm sorry, we do. And I remember the first time I got trained in Sloan Kettering in New York myself, because sadly my husband was misdiagnosed with lung and liver cancer 21 years ago, which is how I ended up getting involved in this in the first place. So I'd been a therapist at that point for a long time, 14 years, and I was teaching for a British company, and I was teaching anatomy and physiology, and then just the short version is he went for a test, and it was an x-ray on his chest because he was going for an immigration visit, and the doctor said, oh, we see something on your x-ray. And he said, well, I had TB when I was 19, lived in London, and I had pleurisy in that lung, and they collapsed the lung when they did a biopsy, so there's some scar tissue there. Anyway, he said, okay, well, we'll do another x-ray. They took another x-ray, they didn't like what they saw, they wanted to do a CAT scan. They did a CAT scan and found a shadow on his liver. So for 6 weeks, they said he had lung and liver cancer, and I just knew that he didn't have that. I didn't know a lot about cancer at that point, but I definitely knew that my husband of 40, what was he at that stage? I think he was maybe 46, did not have cancer. Stage 4, metastatic cancer to the liver, looks quite different. Stuff we were able to do as a family. We had 2 little ones, 3 and 4 years of age. So anyway, long story short, I started doing a ton of research, and we had no phones back then, so I actually had to go to a library, imagine that, and to read, and I had to reach out to my oncologist clients and say, what's the story here? Do you think this is true? And so the very first test he had done was with a lung specialist at Chestnut Hill Hospital in Philadelphia. And he was the first doctor that said, you know, Mr. Clinton, your wife might be onto something here, because his in-office test was fine. He could blow into the tube, he could bring it up to full capacity, and he said, maybe your wife's onto something. So he said, we're going to have to order a PET scan. It's the only way we're going to know if there's any cancer in your body. And thankfully, we found out he had no cancer in his body. But I couldn't unlearn everything I learned over those 6 weeks. So I went to Sloan and got trained in medical massage for cancer patients. And that's how I ended up working in this area. But very often, it's the doctors that need the education as much as the therapists need the education. And I think when we see a collaborative like this, and as many well-intentioned people in one place, I think there is room for us to educate them about what we can do and how we can help. Whether it's with the power of essential oils, the power of plants, we all know what that feels like and what that looks like. And again, I know there are times when people are in active chemotherapy, they don't want antioxidants because they need the chemo to oxidize in the cells, and so they'll say don't use essential oils during this period, but it doesn't mean we can't do it afterwards. And it doesn't mean we can't do it as a way to help with other skin conditions. But we do know that massage cannot spread cancer cells. And I think where I went off on a tangent there when I did my training at Sloan, I can remember the professor saying that cancer cells are very complex and we cannot cause them to move around the body by having a massage. And I think I must have put my hand up like 3 times, but are you sure of this? Are you sure of that? And he was like, first of all, young lady, who do you think you are that you think you can affect cancer from outside the body? So of course it makes you stop and think, you know, we can't affect cancer cells externally, okay? So we can not worry that we're going to hurt somebody in terms of spreading cancer. Can we hurt them by using deep pressure? Yes, we can. And that's whether they're immunocompromised through cancer or diabetes or any other disease. We know that if people have a weakened immune system, they're much more likely to bruise, especially if you're using too deep a pressure. So there are some things that we can change to make a treatment more comfortable for them. But oncology massage and skincare can have a profound effect on the quality of life for our client with compromised health. And so the BBC did a study to actually show what happens to the body during and after massage. And they drew blood right before the massage, then did a 50-minute massage, and then drew blood later, and was able to show how the immune system boosted. So I'm going to show the video. I'm sure you'll appreciate the British accent. I will say I'm not particularly fond of her description of intense rubbing as a way to describe massage. But anyway, so here's the video.
Yes. So what you see is this gigantic cells that has decided to inspect the other cells. And if you have an infection, obviously your surface will manifest that. So the T cells will scan and then say, oh, there's something wrong here. And then we get better information of what's going on.
What is actually happening when somebody receives a massage?
There are some nerves in the skin that then connect to glands where the T cells are stored. And so through the stimulation of the skin, we have these glands releasing a lot of lymphocytes in the blood.
Massage boosts immune cells in HIV patients, but what impact does it have on a healthy immune system? So bring on the massage oils. First, a pre-massage blood test. Then we're off. After an hour of intense rubbing, it's time for another blood test. I feel super relaxed and really quite zen, but let's see what's happened to my immune cells. Fuvio measures how my immune cell numbers have changed after my massage.
Can I just say that you've been a super responder because you not only showed the response that we expected, but also we had a very...
So, I think it's safe to say that we know massage does lots of things, but boosting immune function is definitely one of them. We know that massage helps to regulate our hormones. We know that it decreases pain. We know it increases our ability to sleep. It's like, why isn't this really covered for everybody on insurance? And we know some insurance companies do cover it, but from a global perspective, we're really trying to raise awareness to say massage should be an essential part of our well-being. It's, we've become way too reliant on pharmaceuticals as a solution to our healthcare. And if we could just get out in nature, if we could have a hug with a friend and just be in community with each other, we have a much better opportunity of being well than if we lock ourselves away, take a couple of pills, and don't have any flowers or plants around us. So the advice that we're often given is not the advice that we really, really need. And I know we were talking about this from a community point of view, and I will just say this, again, with the group I just trained in Scottsdale, we had 18 cancer survivors come in over 3 days, and some of these women were newly diagnosed, and some were the ones that had been 35 years, and some had had reoccurrences in between. But just watching them all together and that sense of community and being able to share their stories with each other of support and help, it's profound. And I think we need to remember that we'll always feel better when we can do something from a community perspective. And in some spas and resorts that I've trained at, after the training, the therapists want to do something. They sometimes go and volunteer. They might volunteer at a local women's shelter. They sometimes volunteer at a local retirement center. We know that, again, being older, as soon as we go into a retirement home, we reduce our chance of longevity significantly by being in a retirement center. So there's lots of things we can do within the community to support each other when we're not well. I mean, the old thing of, I know it's still very prevalent here, I have to say, I really like that about it. Sometimes they're church groups, but you know, there's a food train and somebody's responsible for bringing over a pie or a stew or whatever it is, some baked bread. That's something that I see we do every day by giving to our clients. So we give so freely from our energy to our clients, and because we intentionally want to do something good for someone. And if you just think about expanding that out, and we do it within small groups within our community, I think we can have a real profound effect on everybody's well-being. So thank you very much for listening. And there's one other little video if you want to watch it. Do we have enough time, Mike? Is that okay? This is just a video of a thanks, Mike. Do we attach it to that here? So I couldn't get mine to do this here, but Mike mentioned that I do a lot of work with, I chair the Wellness for Children initiative, and it seemed to me that our children really, really need some help. Our young children are struggling. 1 in 6 children have a neurodiverse challenge, and 1 in 5 children basically have a mental health disorder that is not really getting help. 60% of young children that have an issue are not getting the help they need. So anyway, we have a wellness school in Ireland that I did up with my niece. And last year the BBC came and we did a study. And earlier on you talked about music and the power of music, and I know there was a sound bath this morning. So for all those who appreciate vibration and sound, I just thought I'd show you this short video. But the BBC came and filmed this. It's an autistic boy, non-verbal autistic boy who was 7, and he was one of the test subjects. And we were able to show that after 6 weeks of listening to specific music that had been developed by Mindstream, a company out of the UK, that we could see a significant difference in the behaviors of the children. So we'll just play this short video for you. Thanks, Mike.
Music is a really ancient part of our neural architecture. 500,000 years ago, early humans were starting to make music by dancing, stomping, singing, things like language, probably 300,000 years later. So the really ancient parts of the brain, that's what music taps into, and that's why it has such a powerful effect. So music really does transcend boundaries in a way that nothing else does. Being musical is part of being human. It's the way the human brain evolves when we're little children. Music is one way in which autistic children feel they can take control. If you can't really talk very well, it's really hard to get your view across. It's really hard to have a sense of agency. But through engaging in a sort of musical game, a musical dialogue, suddenly they're equals, and that's really important.
Max was born in December, and he was a very happy, calm child. He reached all his milestones till about 18 months. We started to see a change. It felt like we lost him. He stopped talking, and he stopped looking at us. He would turn his gaze up to the ceiling. We couldn't get his attention. He wouldn't answer to his name. speech therapists spotted it at first. Max was diagnosed on the autism spectrum towards a social communication disorder. He doesn't communicate verbally. He has words, but he doesn't use them to communicate. Communication is a big challenge. Tara seems to know what Max wants. He doesn't communicate with many people, and he definitely doesn't touch or let them touch him, but he does with Tara. They have a connection and a communication all of their own. We really would be lost without Tara now. Music is Max's life. He communicates through song most of the time, be nursery rhymes or pop songs, any songs from movies. The familiar songs make him feel happy or relaxed. For Max, he was so happy to get this experience. As soon as he knew it was music, kind of like, oh, okay, this is great. In school, they said his reaction was calming, and it was lovely for myself to see him so happy and content. Something just for him.
Anthropologists believe that music became part of our species as a way of social bonding. It was really important that as we developed as humans to survive, we needed to survive as a group. And that meant group loyalty. It meant having empathy for one another. Music, it seems, was the magic ingredient. And by tapping and drumming and chanting together, there's this bonding. Hormones are released in the brain, oxytocin and glutamate. And when a group of people do the same thing at the same time in sound, we experience that same hormone rush at the same time, and those hormones bond us together.
What I love most about music is its power to connect people with one another, to conjure up emotions, feelings, memories, just a powerful tool. Mindstream is one of the leading music for personal well-being catalogs. We have an incredible, deep and diverse catalogue of musicians who write music to help people sleep and focus and relax, recover and meditate. What we want to try and do is elevate people's musical experiences. The Mindstream pilot study with Junior Genius is a mechanism for us to understand how our music could help in educational environments. We put 4 playlists together for specific moments during the day to understand, is the music working? How can we better the music? Included in an educational environment, what particular scenarios could it really sort of benefit the kids, neurodiverse or neurotypical?
The Mindstream music program works by introducing the music in various playlists throughout the whole day. So we have 4 different playlists that we listen to, individual focus. The noise levels come down, but the concentration goes up. Quiet time when they probably want to go to the cozy area with the headphones, have a bit of time to relax. Sleep time, we put the different songs on throughout their sleep, which drifts them off to sleep. Playtime, which is more upbeat and like it really gets the children involved. It definitely helps with children on a day-to-day basis. They stay focused, it calms them, it relaxes them, and they tend to actually ask more questions. What type of things do you like to do when you're listening to music? You like to dance, Maddie? Like what type of music? Annie, what's your favourite one? A trumpet? And what sound does the trumpet make?
One of the things people can't quite believe when they look at children in the early years is just how sophisticated they are. If you think about it, by the time children are 5, they've already grasped music. They can understand music, they can enjoy music, they can make music. For a lot of autistic children, words are a threat. They don't really understand exactly what words mean necessarily. They perhaps can't speak. And if you analyse most of the language that most autistic children get most of the time, it's mainly negative. It's saying, don't do that, you can't don't climb on that student. Whereas music doesn't criticise, it doesn't tell them off, it just is. It's just a medium of play and of enjoyment.
There's something very special about communication that doesn't have to come across verbally. But I think there's a place in the world for difference. Temple Grandin said,